are standing here in front of you today, two normal teenage girls.
But what if we told you that one of us was in a car crash?
We had severe chronic pain and was prescribed one prescription of the drug that has over 191 million prescriptions yearly, opioids. The relief that we felt on this drug gave birth to a newfound dependence. Well, if that was one of us, then our story would be just one of over 2 million known stories of Americans addicted to opioids. Good morning. My name is Ella Kate Brooks.
And my name is Madeline Friday, and we are here to talk to you about
The killer among us, opioids.
When addressing the issue of opioids, it is important that the true origins of this problem are analyzed. The first begins with a solid understanding of this ongoing crisis is not only in our communities, but the country as a whole. Opioid addiction is a chronic disease which can cause serious economic, health, and social problems. Opioid addiction is characterized by the excessive urge to use opioid drugs.
Addiction derives from doctors prescribing patients legal painkillers, such as opioids, in which they become highly addicted to. Victims begin to love the feeling of euphoria that the opioid provides even after their pain has gone away. After the doctors will not prescribe them any more painkillers, the foregoing patient results in buying heroin off the street illegally.
Unfortunately, rates of overdosing on opioids is increasing rapidly and can lead to unconsciousness or death if not treated immediately with an emergency treatment spray known as Narcan. However, this treatment adds an additional financial burden onto the patient, which in turn harms our national economy.
However, while investigating this killer among us, we wanted to uncover the deeper truth of how opioids affect our very own state, Sweet Home, Alabama.
In 2015, 736 people died from a drug overdose in Alabama. 282 of those deaths were from opioids. Why is this rate so high, you might be wondering? Well, doctors in Alabama are statistically more likely to prescribe opioids. They prescribe an average of 142.9 opioid pain relievers per 100 people, while the rest of the nation prescribes an average of 82.5 opioid painkillers per 100 people. The opioid overdose rate in Alabama is 6.1.
Truly understanding how widespread this problem is has sparked a passion within us to recharge civic engagement concerning opioids. If people in both our community and state were more adequately equipped with the knowledge of how to help recovering opioid addicts, then we passionately believe overdose rates will decrease.
It is important for people to realize that the first step to recover is to seek help by contacting a qualified clinician. The psychologist or psychiatrist contacted will then assess how a patient is doing by a series of questions. The next step is treatment. Treatment can occur in various settings or places decided by the medication the patient uses, their situation, and many other factors. Two examples of treatment settings are ASAM Level 1 outpatient and ASAM Level 2 intensive outpatient or partial hospitalization.
In conclusion, through our analysis of this topic, we discovered that it truly is a crisis. It is our hope that through education and widespread public knowledge of the issue, that people will be able to effectively recognize and prevent the killer among us.